Hi there, this is Dana Arcuri, author, speaker, and wellness advocate, and today's topic is timely because when we entered autumn, people started experiencing coughs, colds, pneumonia, bronchitis, and various infections. And what happens is many end up in the doctor's office and they are prescribed medications, including antibiotics. One of the problems, though, in today's topic is massive prescribed drugs in the United States is astounding. And I had my own recent experience and plenty of years with additional experience to do with the overprescription of various medications in the United States that is basically harming patients. It's placing them in a very vulnerable position. And so first, I'll tell you this one little credible fact, and then I'll share my story. Okay, so here we go. According to drmercola.com, the average American aged 19 to 64 years old is now prescribed more than 11 prescriptions. 11 prescriptions. Okay, so that is a lot. That's more than what most people really need, and we have to understand that when you prescribe one or more drugs, you have a higher risk of negative side effects, severe interactions, and very dangerous symptoms. And so let me move on and tell you my story. So recently I woke up in the morning, and this is at least 3 weeks ago. I woke up in the morning and I had right here, you can't even see it now because it's healing, but right over here on the left side of my neck, right on top of my left thyroid, I woke up and I saw a red rash. When I actually palpated, so you like palpate the thyroid, I could feel there was a lump. And so I was concerned and I just thought, I'll give it a day, I'll see what happens. And so the next day I wake up and it's larger, it's more inflamed, and it's starting to spread. So what began like the dime size then started moving left. So it started going left, and there was like this 1 to 2 inches of this inflamed area that was red. It wasn't really so much itchy, so I don't think I got bit by anything such as an insect. I really was concerned that it was my thyroid, especially because I've had a history of thyroid conditions and nodules, and nothing major, but just some general conditions with both thyroids in my medical history. So off I went to the doctor, and of course she palpated it and said, yep, it's right on top of your left thyroid. Let's get you a sonogram. And so that weekend I went and had a sonogram, and the results were nothing, really nothing major, nothing significant. There was absolutely nothing seen on my left thyroid, so we could rule out, anything very serious or dangerous, or, there's so many things you could fear, but that was ruled out. And so at that point, my red rash in this area was starting to fade, and even the lump was starting to get smaller. And so I thought maybe it was viral. I thought maybe I was coming down with something. And so, but we didn't know. I mean, the end result is we did not know. We just knew it wasn't the thyroid. So the doctor, sends me on my way, and like a week later, out of the blue, I couldn't believe it, the doctor's office calls me and says, the doctor that I had seen over this lump and this rash wanted me to take an antibiotic. Well, that caught me off by surprise, because why would you prescribe an antibiotic when, number one, there is no infection, number two, there were no findings, number three, it is healing, it is fading, it is going away, and whatever it is, good chance it was viral. And we know that with viruses, you cannot take an antibiotic because antibiotics will not heal and repair a virus. So I opted out, said no thank you, but then this really had me thinking about how the United States, I mean, there could be other countries, but I live in the US, so we're focusing on that, overprescribed medications, and it's going rampant. I mean, it is just all the time. Like, you can't go in to see a physician and walk out without a prescription. So we're going to talk about that. Here we go. According to the Center for Disease Control, 1 in 3 antibiotic prescriptions are unnecessary. Oftentimes, after patients are overprescribed antibiotics, their bodies no longer respond to future antibiotics, in which they become antibiotic resistant. So that means in the future, if you really need an antibiotic, like you are in a bad way and you sincerely do need an antibiotic, you may not respond. You may be in a really bad position where you won't get well because you had taken so many antibiotics that were unnecessary. So when the time comes that you really legitimately need an antibiotic, it's too late. Your body is resisting it. So we really need to take heed. We really need to start looking at the overprescription of antibiotics and come up with a new game plan. Another issue is that the CDC research found that most of the unnecessary antibiotics prescribed were for respiratory conditions. A lot were upper respiratory conditions such as colds, flus, coughs, pneumonia, sinus infections, ear infections. And what the CDC found was that antibiotics did not treat it. It was unresponsive. So once again, we have to really ask ourselves, do I really need this antibiotic? And another thing too, stop asking your doctor for meds. I mean, they'll give them to you, trust me. Most doctors are like pretty darn pill happy. You know, they're passing them out like bubble gum. Hey, you know, we usually leave a doctor's office with 1 or more prescriptions, but when it comes to antibiotics, less is best. And there's reasons why. There's 47 million prescriptions each year of antibiotics that are putting patients in needless risk for allergic reaction. So you don't just have this resistance now to antibiotics, but now you have this allergic reaction, or you can have GI distress, cramping, diarrhea, constipation, really bad pain, swelling, bloating, and your immune system becomes vulnerable. And you could have unhealthy candida in the gut, because what happens is when people take antibiotics, it really changes the gut flora. So you no longer have good bacteria. You become consumed with bad bacteria, in which leaky gut and candida can be the outcome of taking antibiotics. So it's something to consider in case in the future you will be prescribed an antibiotic and you may want to think of something else that you can take that's natural, that doesn't cause candida, leaky gut, or antibiotic resistance. Beware of some potentially destructive antibiotics, and I know this from personal experience. Check out my video on Cipro, but in the meanwhile, we're going to talk about the, let me try to pronounce it, people, fluoroquinolones. Oh geez, it's a long word, and forgive me if I mispronounced it. You get the gist of it. It is a category of antibiotics that includes Cipro, Levaquin, Fluoxin, and so many more. This category is a big red flag. Do your research, educate yourself, check out the black box warning, but understand that it is linked to sudden, serious, and potentially permanent nerve damage called peripheral neuropathy. There's also a long list of side effects with those antibiotics, including Cipro. And it was no day at the beach for me 8 years ago when I was prescribed that drug, sent me into the ER, in which the doctors didn't do anything and sent me home, in which my life spiraled out of control. Now, there was more to that story, because when you are prescribed this Cipro or the Levaquin, Fluoxin, and this whole fluoroquinolones antibiotics, and you mix it with other drugs like benzodiazepines, Lyrica, Cymbalta, and other various medications, you get a cocktail of potent chemicals that slams you with some horrific symptoms. You may have a personality change. You may become extremely moody, hostile, aggressive, suicidal, homicidal. You may just want to do things that you normally wouldn't do. And you may have dizziness, vertigo, stomach aches, headaches, and for whatever reason, you're even prescribed this antibiotic, it's not working. You're not getting any relief. So the end result is it was just a really, really rather poor experience and a live and learn moment that you never want to forget, because that's a drug you're going to mark down as no. And when you go to the doctors and they say, what are you allergic to or what can't you take? Be sure to give that drug, because you don't want to take Cipro or anything in that fluoroquinolone family, especially if you take Benzos, Cymbalta, and other various drugs that have severe interactions. When you take these drugs together, the combination's very toxic, very destructive. So beware. Next, we have to understand that while people may have, say, a UTI, bladder infection, kidney infection, and they need an antibiotic, we have to understand that there are other antibiotics other than this category, such as the Cipro. There's other drugs that you could take that are a lot more gentle and less destructive on your body. And also know too that when you're done with your antibiotics, you can always consider doing things for your gut health, like taking probiotics to restore your friendly flora. Let's move on. Again, as a reminder, if you're taking Cymbalta and benzodiazepines, understand that those drugs just in themselves are also a potent prescription, and that it's another prescription that's overprescribed. There's just millions upon millions upon millions. I mean, the numbers are astounding. The people that are prescribed these drugs, and then they're experiencing the very negative, alarming symptoms and withdrawals and this nightmare that is something they may have never experienced in their life. And then they think their life is coming to an end because they are losing their health, losing their mind, losing so many different things. You could lose your job, lose your family, lose a lot. It's a loss. It's legitimate. And it should be a concern. People in America should be alarmed. These are toxic drugs. I'm heading into my 8-year anniversary coming up in about a week, being 8 years free of Cymbalta, the drug that nearly killed me in 2010. And the live and learn experience, the little nugget that you take away is that medication has a black box warning. It has killed many of people. There have been a lot of fatalities, a lot of lawsuits. And when you start mixing Cipro, Benzos, Cymbalta, gabapentin, and all these other drugs, you just keep on slapping on another drug, adding it to the potent cocktail of chemicals, it just spirals your life out of control. It becomes extremely dangerous for your central nervous system, your neurotransmitters, and your overall entire body. We cannot expect to take medications, especially one or more, and not have any negative response. We have to understand that despite the FDA approving these medications that are on the market today, we have to understand that that doesn't mean they're effective, they're safe, or they're healthy. You might want to check out that video too, to do with the FDA, and that we need to rethink health. And so today I am so grateful for things like essential oils, CBD oil, which is very wonderful for being antiviral, antibacterial, anti-inflammation. It helps with pain. It helps with depression, anxiety, insomnia, fatigue. There is just so many countless benefits of CBD. Then we have other things like sovereign silver. Some people like echinacea, different various natural wellness like elderberry cough syrup. Elderberry is an awesome consideration for this time of the year, and you could check that out yourself. Go to danaarcuri.com. Be healthy.